Hello, Mr. Steve Yusupov. Lovely to have you on our podcast. How you doing?
Glad to be here. Doing very well, thank you. It's
Very
a
good.
beautiful morning and nice to catch up with an old friend.
Absolutely. We go way back. I think we go from Forest Hills
Yeah,
times. Yeah?
literally from high school
Wow.
days, junior high school days.
Yes, yes,
Halsey.
yes. Yes, Halsey,
Yeah,
Forest. Oh my God. I think we have the same crowd of friends also. And it's amazing how we all grew up together and now everybody's in business, everybody has a family, kids, and it's just amazing to have you on the show so you can express and tell us about what you do and how you came to where you are today.
right,
And I want you to just tell me a little bit about what is it that you do to let the crowd know,
right,
and I'll ask you some more further questions after.
right. So as you said, our group did very well, and I'm proud of it. So I'm gonna share my side of things. I'm an oral maxillofacial surgeon. It's a dental specialty. So I'm a dentist, but I'm also a physician.
I didn't know that
And
you were a physician.
yeah,
Does it come with the physician as you're an oral surgeon?
so it's not a requirement,
So it's not a
but
requirement.
it's an option. About half of oral surgeons in America are physicians. So it's additional training. Obviously, I had to do medical school after dental school and a fairly lengthy surgical residency. And afterwards, what I did in addition is I obtained a training in head neck oncologic surgery. So treating cancer of the head neck region, mouth cancer, salivary gland, stuff like that. So that is more of at the time when I trained, it was a more of a medical kind of arm of healthcare, but I obviously kind of combined the two, bring the two together.
So when you started to go to school and what was your main interest? Did you right away wanted to become where you are today, or how did you gradually get to where you are?
In retrospect, well, obviously Vision's 2020, the answer will be yes. But obviously I didn't know where I was going to end up.
Of course.
If I give you my personal statement answer, yeah, I wanted to help people and do all those things that you put in the personal statement, which is all true. It's not I didn't lie on it, but I did want to help people, wanted to be in healthcare. But what I really wanted to do is I wanted to be a surgeon. But I was 14 years old when I came to this country. English was a second language. I came from a minority community, a Jewish Russian immigrant, the whole thing. And I was only a few years in the country when I was in college, and advisors, friends, colleagues, people said, "What are you talking about? You're going to be a surgeon?" And at the time, and some of it is true now, surgery in America was very, sort of a closed community.
Correct.
You
It's
know,
hard. It's hard. It's hard
y-
to get in,
yeah,
especially when you're a few years and you just came into college. And
yes, it's
I don't know.
hard to get in academically, and it's hard to get in outside of academics.
Honestly, I don't know how much patience you have to do all of these things. I'm honest. I bow down to you. I do.
Please don't. Please don't. But this was kind of what stopped me from pursuing surgical career in college. I had to be blue blooded. I was an immigrant kid, so somebody made a suggestion. Friends, advisors. Why don't you become a dentist? So, you know what? At the time, it seemed like good settlement. You work with your hands. You're still in healthcare. Obviously from our cultural background. Financially it makes sense. So at the time, I chose dentistry in college. Really wanted to do something bigger, but dentistry seemed, fun. You work with your hands, you work on patients. You may not be, cutting people open and helping them via these major operations, but still, something in
It's
that
a start.
ballpark. So I started dentistry and I liked it and I did well in dental school. And as I was going through school, I realized that I really want to do something bigger. And things were going well, thank God. And I was putting my due diligence, and I realized that there is a field that is a subspecialty of dentistry, and it was oral surgery, and I got really interested.
Was that during when you were already married, when you already went further, or
So
how
I
did
got married in dental school.
in dental school?
Right.
Wow.
I met my wife right as I was finishing college, and the usual kind of train of thought well, let me finish school. I gotta get financially ready. But I think we jointly, I think in retrospect, made a good decision. I did not wait to finish. We got married right in the middle, so about 2 years in, and she supported me. I probably would not.
As every great woman should.
Exactly, exactly. But sometimes we take it for granted.
Absolutely, I
She,
definitely agree
my
with that.
wife could have easily pushed me to say, you know what, go make money, go be a dentist. But she endured it. It was a long journey.
Of course,
It was a long training,
I
and
honestly don't know how you have the patience to go through the whole process, and I'm sure you have kids in this whole situation throughout
right.
the whole
I
process.
I think that's where passion comes in. You really gotta love what you do.
I agree.
So that's what got me through. If I had to do what I did, not absolutely loving 110%, I probably would have quit. I probably would not have finished it. I put in a lot of countless nights, 36-hour shifts in the hospital, taking call. I really enjoyed every minute of it because I liked what I do. If I was doing something else, or if somebody was doing what I'm doing and had no passion about it, they would have not finished it. So yeah, that basically was the journey. I got married in dental school, and my wife supported me with the decision to do it. So just to put some numbers on it, so 4 years of college, 4 years of dental school. So halfway through the second four, halfway through the dental school, I decided that I want to do oral surgery, and that's additional 6, which
Patience.
includes the medical school and the residency. At the time, I didn't even bring up the idea of doing fellowship, which I did afterwards. And I said, if that's what you want to do, that's what you love. I'm there for you. So she kind of was alongside with me, and I went for it. And I mean, acceptance into the program is it's one of the top um, specialties in dentistry to get into. One of the few difficult ones to get in, and you gotta do your due diligence and applied, went through the whole process, and I got in Brooklyn. So I trained. I did my to kind of outline the training. I did my undergrad at Queens College, CUNY. So grateful I went there. I mean, that was great financial decision, great educational decision. Um, did my 4 years at Queens College. Then I did NYU for dental. Big name, like on the other spectrum, I think, of reputation from a CUNY school. It's a private school. On the other spectrum of things, financially, super expensive. But again, I'm thankful for them for whatever they've done for me. Even though it cost me arm and a leg, which I'm still paying for.
but
While
but right now you see the blooms that came out right now, and you're enjoying it. You're
yes,
working, you're making money, you're making people happy,
yes,
you're putting a great smile on their face, and that's what is important.
right. Ultimately, yeah, NYU is responsible for allowing me to do that. So ultimately, I'm grateful. If I sit down with young students, dental, prospects. There's pros and cons. There are other options, but overall, yeah, I'm very grateful. But it traumatized me a little bit, the financial part. So when I was applying for medical school, I said, no more private, no, no more NYU caliber schools. I could have stayed. I actually liked the program for oral surgery, but I went for SUNY downstate. I went to Brooklyn. I went back to a state school this time, a much lower tuition, and I think that was a blessing. I think I got an amazing education in the middle of Brooklyn. Um, did my residency in an affiliated program at Kings County.
How long is the residency?
So it's a combined program. It's 6 years of medical school and residency together.
Paid?
Obvious, um,
Is it paid?
some of it during med school you're not getting paid. During residency you're getting like a minimum wage, not minimum, a little bit more than minimum wage, but at the time I was averaging about 50,000 a year. I mean, for a physician, for a doctor, for a dentist, it's on the lower end, but something
Better than nothing.
better than nothing.
Definitely.
Yeah. So you kind of start school, residency together, then you kind of take off full time doing school, medical school, and then you come back to do a year of general surgery, had nothing to do with dentistry. It's just a part of training. Operating people's bellies, doing appendicitis surgery, stuff like that. But it's part of it. And then you come back and finish. So Did my 6 years there. I gotta say it was an intense experience. Being in a level one trauma center in the middle of Brooklyn, taking calls, taking care of trauma patients, taking care of like
Let me ask you, but why oral surgery? What made you go into that particular where you actually enjoying it? What is it there that you enjoyed?
so. Like I said earlier, that I started by going to dental school and then kind of build upon established. But in retrospect, if I had to choose now to go into any specialty in medicine that exists, I would still choose what I do now. I mean, the way we could help people, the way we could change people's lives, literally from curing somebody's mouth cancer or giving somebody a brand new smile. It's just such a cliche thing, but this is exactly what we could do today with our technology, digital technology. No more, old school impressions like dentists used to take. Everything is now, digitally acquired, 3D printed, where I could literally take a patient with the failing teeth. Somebody has pain, no confidence, cannot smile. I could take him into my office in the morning and have him walk out in the afternoon with a brand new set of teeth. Not dentures, not something that you come, take out, put in a cup at night. A fixed set of teeth.
Wow,
And now
that's great.
this is kind of shifting gears a little bit, but getting into like dental perspective. If you look at some statistics, you know, kind of just quick question: how many percent of Americans do you think go to see dentists regularly?
Not that much, but I like at a certain age where it comes much more often, where it has to be like a
Right.
regular thing.
And there's a catch up too, but the number is 40.
40%.
40% of Americans see a dentist regularly. And now, kind of combining that statistic with a little bit of post-COVID, pre-COVID era, people would go to see a doctor more frequently. Maybe you go see your dentist, for major, work every once a week, every 2 weeks for several years to finish a major case. People's mentalities have changed. People don't want to do that now. We're living in a different world post-COVID. People don't want to go to a dentist so many times. So, constant exposure to a waiting room, constant exposure to other.
So you're saying it's 40% now
So 40% of Americans
after
see a
post-COVID.
dentist. These are post-COVID numbers, but
Okay.
I don't think that was much different. I'm
I
just
don't-
saying,
yeah.
take those two pieces of information into account, which brings me to a point of if I could take somebody and give them a major overhaul, get rid of all the bad teeth, put implants in, and put teeth in their mouth in one sitting, one shot. That is probably so much more appealing to that 60% that doesn't want to see a dentist. In addition, when you're getting the procedure, you're fully out. You don't have to sit and keep your mouth open and get shots and have somebody, stick their fingers in your mouth. You're out. You come in the morning, put your arm out, IV goes in, you're knocked out, you wake up, everything's ready. Everything's done. You have a brand new smile. You got to give it some, phase of healing, but, you're going to bite into an apple, eat a steak.
Wow.
Like you get that functionality and aesthetics. So that's kind of, been a big passion of mine within my specialty, within my realm of what I do. I mean, it's a small percentage of what I've been trained to do, but it is something that I think really changes people's lives.
That's amazing.
And
Honestly, I've been speaking to some guys who had your services, and they're in love with the way you approach every single person, client, patient, and it's amazing. And then also from the other side, I speak to dentists. I also have clients who are dentists, friends, and they all raving about you. I'll be honest with you. No jokes, all jokes aside. And you made yourself known, and you have an image where you are that guy where people look up to. So you have to keep that phase now and do the right thing, which I'm sure you do.
yeah,
But you have a cursor on yourself where you have to be on a certain level now, and how people look at you, and it's very
right,
important. And you have that look.
right. Well, I appreciate you saying that. It's always good to hear
Absolutely.
because that is the goal.
And
every day.
this is not what I'm saying. This is what I hear from other
Right.
people, and I honestly, it's amazing. I love it. I'm like, yo, this is my friend. Mr. Steve is my friend, and we are doing business together. And I'm
Yeah.
happy to have you on the show here. It's just amazing.
Thank you.
I
Thank
love
you.
it.
Certainly glad to hear that. And like I said, that's my goal. Waking up in the morning, most optimal patient experience. And I'm not a primary care provider. People have their doctors, people have their dentists that they have closer relationship with, that they see on the daily, whatever, on the monthly. And when a dentist that knows somebody for years and years and years and constantly seeing them for cleanings, for fillings, seeing their family, when they decide to send that patient to a specialist, I better deliver. I better have them be so proud giving my business card to that patient and saying, this is who I work with. I want to make them look good by catering to the patient, by giving them the most optimal experience. So I think you hit the nail on the head. You said the patients are happy and the dentists are happy, and that's the goal.
That's the goal.
That's the goal,
That's
and by ultimately making the dentist happy by making the patient happy. It's a circle, but I think that's the idea. And you being a business owner and a professional, like a lot of things go into our daily lives. The finances, unfortunately, fortunately, unfortunately, money controls things, and your daily logistics, and then your identity as a professional. So I think the goal is to put all of that together and ultimately put out a result where everybody's happy.
absolutely. How do you juggle being the surgeon, being the owner, being a father, a husband, and everything in between, being that person all around? How do you have manage all those times?
I think it goes back to the same thing I said earlier. It goes back to passion.
That's true.
So you gotta love what you do. It's a very cliche line, but if you love what you do, you don't never have to go to work.
I definitely agree with that statement. You said it
Yeah.
on the money.
So as cliche as it sounds, I think it's true, and I do love what I do. I'm at work, but I'm not. I'm doing what I want to be doing if I had a choice. And same thing goes about being a family man, about being a father. We're all passionate about our families, right? We all love our kids. So I think it's a combination, like you kind of wake up and you start your day with fun things, and you run your business. I happen to like that, end of practice. I like being a business owner. I like being a businessman and managing people. Some people don't like that, and there's nothing wrong with that. Some people choose not to be a practice owner or a business owner, and it's fine. I'm lucky to have that um, as part of what I do, and super important, I think. And it's for the younger people, for students, and somebody trying to start their careers. I think it's super important to find time for everything else. So the kids, the family, the business is important, but then things like exercise, things like self care,
Exercise what? Your brain, your
physical
physical.
physical
Okay,
exercise.
okay.
You have to maintain the tools, right? You have to set up systems. So if you walk into my office, I have the most up to date digital technology. I have the best instruments that could potentially exist. Same thing with myself. Us the bodies are our tools of the daily, and I think that needs to be maintained. You can't be like this tunnel vision, work, 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 business, business, business.
So you're saying that you go to the gym a couple of times a week?
Yes.
Really?
I
Nice.
may not look it, but I always say abs are made in the kitchen. So you can work out as much as you can work out, but I think the diet defines you, and that's in a way, and so our culture plays into it as my weakness a little bit. The
Oh,
diet.
it's on our culture. This is another thing. Our
Yeah,
culture doesn't help us in that aspect. The
yeah,
only thing that it helps us is the gatherings.
right. I mean, our culture has a lot of benefits. I think we're doing the Buharians. I think it's doing very well, but I think you're right with the food and with the health impact. Our culture is tough, but doesn't mean we can't try. I think you always have to kind of have a goal set in mind. And I mean, in my mind, those two things are like parallels. Physical exercise and your diet. I mean, if you're not doing well with the diet, doesn't mean you need to drop exercising.
I agree.
So yeah, I think it's important. It's part of what I do. I think I got on this wave of staying active back in 2014,
Wow. So
and I
been 10
haven't.
years probably. Wow.
Yeah, and I haven't stopped, and I always
Maintained.
maintain, and I always tell the younger, so part of being, if you look at, in Latin, doctor means, if you translate verbatim, doctor means teacher. So part of what I do by default, I have a lot of college students, dental students, medical students, residents around me on the daily. I go to the hospital to do my surgeries. I have residents becoming oral surgeons. In my office, I have a lot of students coming in to shadow. I have a lot of college students coming in applying to dental school or medical school. So I usually tell them always, always kind of have time for everything else besides what you're doing, besides your main goals in life. And maybe when I was a student, I think in retrospect, I actually probably failed at that a little bit.
Why?
I mean, I didn't have anybody, tell me that or
To
teach me
guide
that.
you. To guide you.
I
Yeah.
mean, back then, big goal was, just, kind of get it done, go through school, just get the numbers you need, get the grades you need, kind of neglected the health a little bit, neglected
That's
the
what it is.
exercising, but then caught up, kind of
I hear you.
got back to it.
That's good. That's
Yeah.
good. Let me ask you another question. In your family, are there any dentists, doctors, medical field?
Not indirect. So none of my parents are doctors. None of my parents are dentists. I do have somewhat, kind of somewhat distant relatives. So I have,
So no direct blood, and this was all you. This is what
yeah.
you wanted to do, and you made it. And I'm. Do you look at yourself in the mirror and you say that I'm proud of myself?
I don't think there's much value to do that.
Why not? I heard it's a good thing to compliment yourself. That way you feel bolder.
I
No,
don't know.
I heard from somebody where you compliment, not every time, not to be conceited or anything, but
Yeah,
to look at yourself and say, you know what, I did it, and you're not doing it to show it off. You did it for yourself.
yeah. I think twice about that.
Why?
I don't know. Maybe when you say that to yourself, you kind of making yourself like content with where you are, and maybe you stop the growth.
Yes and
I don't know.
no. I agree, but also you want to compliment yourself. Just like a child. You want to compliment on their scores, on their tests. Why do you compliment them? So they can do better next
Right.
time.
I compliment my kids.
Of course, so as we
I
should.
compliment my trainees, but I'm a very high standards person.
So let me ask you another question. What do you expect from your kids? Let's say
My
when
wife sometimes tells me, you might have been raised by wolves." I have very high standards, and I
around the
think
house or in school, the way
with
everything.
with everything, with my kids at home, and with my trainees in the hospital setting. I have
Nice.
very high standards, and
So you're like a perfectionist, you would say?
I'm in a way a perfect. I mean, there's always room for
Of course.
imperfection, but my standards are always high, and a lot of my trainees in a hospital setting will say Steve's such an asshole. They call me Dr. Yuspo. They say this is such an asshole because I'll be rough on them. I'll be rough on them, but that's how I see it. That's how I think they're gonna achieve what they're gonna achieve. And the red flag would be is when I'm getting nice to a resident, when I'm either not talking to them, I'm being super constructive and super nice. That means I lost all faith in them.
Wow.
That only happened a few times.
How many years have you been training other people?
So it's a constant medical training is a constant teaching. It's
Correct.
a hierarchy system in training. So my residency was 6 years plus 1 year fellowship. So that was 7. I mean the responsibility of teaching is there, but not as high as let's say when you finish. So when I finished, it was just 5 years ago, and I became an attending physician. So now that's usual the terminology. You go from being a resident to being an attending. Obviously, the responsibility goes up. And to give you like a setup, a scenario. So let's say we're in the operating room, treating a mouth cancer, whatever the surgery may be. I may have several nurses and scrub techs, people that deal with, sterility in our instruments. So starting, from them, there could be a student or several students. There could be an intern, which is a first-year resident. There could be like a mid-tier resident, like a second, third, fourth, fifth-year resident, and a chief resident. And on occasion, there could be a fellow, meaning somebody who finished their residency and now they're doing fellowship in certain subspecialty. And everybody has different responsibilities.
Correct, as they should.
As they should, and that's kind of the progression. You go from the student level up until the fellow.
Keep going, keep going.
And ultimately the attending.
So let me ask you a question. You know how there is always a person that you're training and he has some sort of a gift, something that you know that he's going to do unbelievably. Did you have those?
Yeah, totally. I had several, and then the gifts come in different shapes and forms.
Of course, everybody has their own styles.
So I had several residents who I thought were like truly gifted with their hands, but they still need the training.
Of course.
I had several residents who were truly gifted with their mind, and not just smart, not just book smart, but like just a certain mental drive, where when they're performing, when they're doing surgery, they may not be anything special, but the mental pressure they put on themselves and kind of always put themselves through experiences and training, they kind of, you could see that the end result is different. And residency is not like school. There's no syllabus, there's no curriculum, there's no exam. Residency, you could easily be a slacker and not really pick up much and finish your 6 years, or you could be a gunner, or you could be like top of the food chain kind of guy, and nobody controls that. Especially in my program where I train, it was
why is there no control?
At that point you're already
how do you evaluate?
There's some evaluation, but you carry a title of a doctor at that point.
Mm-hmm.
So it's a little bit kind of, you're there because you want to be there, that kind of thing. So your residency is essentially your time to get certain experience. I mean, they try to structure things for you and evaluate things, but it's not as strict and not as handed to you on a platter as a school, as a dental school, a medical school, where it's much more formal. There's milestones. Residency has its own milestones, but they're not as structured. So it's kind of a different world a little bit. So yeah, back to talents. I had several, and I'm not here, naming names, but I had several
who really
people from community.
Also, well, nice,
yeah,
very nice.
And
nice.
One I could think of was truly talented, hand skills wise, and one was definitely like a visionary and kind of a lot like me, I would say.
Do you see sometimes where you're training and you see yourself in them?
Yeah.
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 Nice.
Yeah.
Nice.
I mean, I want to see more of myself in them, but it's not always the case. But yeah, there's definitely situations where I think this guy reminds me of myself.
Nice.
With the dedication, with the passion, and I'm looking for those guys to join me.
So, how much pressure are you really going to give your kids? Do you want them to be on the same in the medical field as yourself?
Not necessarily. So as I may have high expectations, but pressuring somebody, and if you're not getting the result, you may break them.
Correct.
So I may have the expectation, and I still gauge it. I still gauge what the process is like. I'm putting the pressure, I'm putting the expectation on my kids, but they're still little. It's hard.
You're planting a seed little by little.
Planting a seed, talking about it.
Of course.
You start slow.
Absolutely.
You start, bringing it up. You start talking about it at a small age. Like my son is 3. And every now and then I'll tell him, "Do you want to be a surgeon? Do you want to be a doctor?" I mean, he has no idea what I'm talking about. But it's just kind of probing. My oldest is 12. Now I'm having these discussions. I mean, do I really want my kids to be in healthcare and in medicine? I would prefer that. But if they don't follow my footsteps, it's not. I don't think it's the end of the world. I think I'm gonna be okay. I mean,
Are you
obviously,
gonna be okay? Because your expectations are high, but you want them to be. What if they're gonna pick something that? What if they want to be a teacher? Are you gonna be okay with that?
I would still have high expectations of being a teacher. Yeah, I mean, if you're gonna be a teacher, be the best teacher you could be.
No, absolutely. Listen.
Yeah, I still have high expectations, but yeah, I ultimately want my kids to do what they want to do.
Mhm.
So this is where we're starting to violate some of our Buharian principles. I really want my kids to do what they want to do. I really want them to follow their true passion. I would never want them to be in medicine, in surgery, if that's not what they like. I would never push somebody into it. I think that will be it's going to be so destructive.
I hear
It's
you.
going to make them a bad doctor. It's going to make them miserable during training, and I just don't think that's the way to go.
Like my father used to say, it's either you do it right or you don't do it at all.
Exactly.
That's
Couldn't
what it
agree
is.
more.
100%.
Couldn't
Those are
agree
my
more.
father words.
Yeah.
Also, are you involved in any communities that you're helping out? I don't know, any of those like that you help out?
The answer is yes. So our community is fairly small community, and I think overall we're pretty blessed in terms of Baharian community having finances. So thank God there's no dire need for our community to have my services donated or whatnot. But there's some instances, with the some of our religious leaders. Um, I do have much bigger involvement out with charity work outside of our community.
Correct. I was.
Yeah.
That's what I meant to say.
So
Charities, different types of organizations that you help out and you support.
yes, very heavily involved. And the first where I started is one of my role models was my teacher initially, and then I ended up working for him. My first job that I had as a surgeon was in Staten Island. Dr. David Hoffman, who's
How
in his
long?
early 70s.
How long have you been working with him?
So I started as his resident in 2015,
Mm.
and when I finished training, I worked with him alongside him as his partner, surgical partner, and I was there up until I opened my own practice in 2022.
Very
So
nice.
we were still friends, we're still colleagues, we still call each other. I bounce ideas off of him, but the reason I brought him up when we're talking about charity is he's been involved in a mission trip to Colombia since the 80s.
How does
Imagine Pablo Escobar that he's going to Colombia to operate on babies. So he's a cleft and craniofacial surgeon. That's his specialty. During training, that was probably one of my least favorite fields. I love kids. I don't really do well with sick kids. But when I joined his practice, kind of by default, not so much by choice, he had high volume of cleft and craniofacial patients. So I started getting involved with cleft lip and palate, like kind of simple terms, the babies with the cleft lips.
Of course.
And I picked up some of the skills from him working for him. And he has a mission trip to Colombia, the country Colombia.
Wow.
And so we went. He's been going once a
So
year.
you also went with him
I
one
went
time?
with him, and we performed surgeries on babies in Colombia. It was a kind of a yearly thing. Springtime would come around. We would do fundraisers, charity kind of events, raise the money, prepare the instruments, prepare the team. When he started, I think it was a several surgeon kind of thing. When I was going with him in the past several years, I mean, the last trip I went on, we probably did 150 operations in the duration of 1 week.
In the duration of 1 week,
Yeah,
150 operations.
Yeah.
Wow.
So, yeah, I mean, those trips, I get no credit for organizing. I was just performing, but I give him the credit for organizing it over all those years.
That's amazing.
And he introduced me to this. I mean, these are like very rewarding moments when you do that. It's in the middle of nowhere. This is not Colombia that people go to visit. This is like middle of nowhere mountains. We had to take military. You fly into Bogota and you take a military plane into the mountains.
It's like a third world country there.
Third world country. I've been to a lot of places in the world. And quick story, like, I was in Israel once, in like the northern Israel somewhere. and we're driving on the street, and there's a guy on a donkey, and I was, just talking about it during the trip. I says, I want to practice my Hebrew. I don't really speak Hebrew that well, but I, picked up some, and I said, everywhere I go in Israel, everybody speaks English. You try to speak Hebrew, and they like hear your, broken accent. They start answering you in English. So I'm in this, North Golan Heights region. The guy's in a donkey, and he's selling like water out of the back of the carriage. And I said, you know what? He probably doesn't speak English. He, gives me a chance to practice Hebrew. So I pull over and try to buy water from him. The guy answers me in English. So anywhere, I mean, I've been in Asia, Europe, anywhere you go, the only place where a cabbie, a taxi driver, cannot even communicate with you was in Neva, Colombia. That's the place where we went for the mission trip. They do not even speak English there. They get taxi drivers. So that's how remote the area is. And that was my introduction to this, to kind of medical mission trips. And
You only went once, or you went a couple of times already? You're doing it on your own?
Several different organizations. So I'm just telling you about how I got involved in it. I'm actually going to Guatemala in a couple of weeks, end of this month. So I'm not with not with Dr. Hoffman anymore, but I'm still continuing this. I'm still continuing
Nice.
charity
So
care.
he planted something good
Yes.
in you that you're gonna continue.
Yes.
Well, that's great.
And
That's good.
I think he introduced it to me. I saw what we could do. I mean, our services could range from something, super expensive. Some things we do just by default has to be, because of what we put in. Like the teeth in the day I described earlier. It's a pretty expensive procedure. I'll be honest with you. So it's like a balancing. It balances you off. Kind of you go.
I feel like you feel better than when you do. I'm sorry. I feel like you feel better about yourself when you do those type of procedures more than the money that comes in when you're actually getting paid. No,
Yeah,
you have those moments.
definitely.
Oh
I
man,
mean,
I
you
feel.
overwork. You go to these trips, you're overworked. I mean, you're operating for 12 hours a day, and then it's like a group of surgeons. Like some of us like don't really see each other when we're back home. Colleagues from different states. By default, we come back to the hotel. We'll have a couple of beers. You catch up. The next thing you know, it's 11 p.m. or it's midnight. You go to bed and then you're up at 5, and you do that 7 days a
Wow.
week. You come back really exhausted from those trips. So yeah, like I was with David Hoffman, and that was kind of his initiative. What he introduced me to next, which kind of I sort of took over from him a little bit. He's through his connections found these children across the world, and like one of the most memorable ones was there was a child in Africa. He was growing this benign tumor in his jaw, and it's not cancer, so it's not gonna like spread across his body and kill him, but it's growing, and it's gotten to a size where it's a soccer ball size, like that in his jaw, and he couldn't eat, he couldn't speak, they couldn't treat him back home. He was in Liberia, and he was getting malnourished. He was 18-year-old boy that was basically sized like a 12-year-old, and Dr. Hoffman somehow, or they found him or he found him, so we brought him here. That was going to be a little bit, a little bit too complex to do in a remote area. So we brought him here to New York, and we operated on him. And I actually have some photos on my Instagram page. He literally came with this tumor. I led the surgical team removing it. We did the operation, took the tumor out, took care of him. He stayed a couple weeks in the hospital, and then the pandemic happened. So he kind of stayed here longer than he should have.
Oh wow.
But we kind of some of his reconstructive attempts were a little bit complicated. He needed a couple surgeries, revision surgeries, but we sent him back with teeth looking normal. Wearing a USA hat with the with the American flag on it. So things like that. Those are actually like like unique experiences. Like kind of definitely makes you feel rewarded. When you kind of look at the before and after. Definitely a life saved. And definitely in a place where if we didn't do this, if David Hoffman didn't bring him in here or found him and handed him to me to surgically take care of, I think he would have been dead right now.
Wow.
Another organization I'm part of is there's an organization called Little Baby Face Foundation. One of my kind of other colleagues, who's he's not a dentist, he's a facial plastic surgeon, a good friend of mine, one of the top guys in rhinoplasty. So he's also tailing his career, but in the 80s and the 90s, he was probably one of the biggest names in the nose job market.
Wow.
He has a practice on Park Avenue, still very high-end facial cosmetic surgeon. I don't do any facial cosmetic surgery, but he's also into charity work, and he created an organization decades ago called the Little Baby Face Foundation.
Mm-hmm.
So they raise funds, organize, and bring kids here to New York, and we donate our services, and they kind of cover their stay, they cover their the hospital expenses, stuff like that. So this week on Thursday, I have a kid coming from Virginia. It's not always from overseas. I have a kid coming from Virginia who needs major reconstructive surgery. It's a condition called hemifacial microsomia. So we're doing a pretty major facial reconstruction on this child from Virginia. And Little Baby Face Foundation is sponsoring it. Kind of, give you the quicker version of it. There's another organization called Orca. There's a 9-year-old child in Guatemala that has a big tumor, similar tumor to the child in Africa.
Yeah.
So I'm going in at the end of the month. So we're doing surgery there on a 9-year-old.
Wow.
With the pretty elaborate reconstruction. We're doing an auto transplant. So when you remove part of the jaw, you have to build their jaw back to put implants in and give them teeth. So we take their leg bone. So the bottom part of the leg actually has 2 bones, and we take one of them and use digital technology, 3D printed guides. We'll do the entire operation on the computer, shape the leg bone into the jawbone the way we need it, print the guides that will allow the saw to cut in a certain direction where we could fold it in the way where we could put implants in that will perfectly fit like their jawbone.
Oh, wow, that's incredible.
So that's coming up in Guatemala. So this month I have 2 of these major operations. March, I don't know, we'll see. Something will come up.
That's amazing. Let me ask you a question. Let's go back for a second. How many times did you want to give up? How many times you were like, you know what, I can't do this anymore. I'm tired. I can't stretch.
Never.
Never? You just kept
I didn't
going?
see myself doing anything else.
Really?
No. Yeah.
That's it.
Not a single time. As tired as I was, back in residency days, taking call in the middle of the hospital. I mean, there were days where I was tired. I was unhappy with the volume of work that I had to do, but I don't think I ever thought about quitting. I just did not see myself doing anything else.
Wow.
I don't think I could do it. I don't think I could do anything but this. Truly love it.
Honestly, you inspire even me. You are unbelievable. I didn't, knowing you from high school, I would never think in a million years that I would see you as not that you're not a bright guy, but I don't know. It was just, sometimes you see guys and you don't know that, but on the level that you are, you're unbelievable. Honestly.
Thank you, Boris.
I really look up to you myself. If my son wants to be a doctor, he's not sure what how. So I'm thinking of every summer I'm gonna take him to different industries and as intern and see what he likes.
Yeah.
So you're gonna be one of those guys.
Of course, almost welcome any day.
Awesome. I love
I'll
that.
have him any
My
day in
son
office.
is gonna love it. He really wants to be a plastic surgeon, but listen, I'm gonna give him options to see what he
Yeah.
really likes. And he's one of those kids who's really driven. And if you want something, he hasn't let me down yet.
All
I'll
right.
tell you that much.
Good. Have high expectations.
He has higher expectations than me.
Good. Listen, drive is important.
Absolutely.
I think that's being motivated and dedicated is important. And funny thing is, we talk about this, and I talk a lot about this to some of my younger generation, to my friends. I mean, we're at a point where our kids, like you just mentioned, your son, thinking about college or in several years going to be in college and choosing career path. One of the topics that I always have when I have these, sometimes the conversations and discussions sometimes turn into debates.
That's
So
awesome.
a big thing I think is the difference in the generations.
Yes, I agree
So
with
we
that.
started this conversation by saying how our circle of friends from junior high school and high school did very well, in whatever respective industries they did that, and I'm proud of us, of our community, and overall Bahrain community is doing very well. And question becomes: is the next generation gonna do as well? And there's some arguing points on each side of the answer.
So the way I feel personally, it all depends on us.
Absolutely,
How we
absolutely,
instill certain things to
yes,
our kids, and if we're gonna provide them everything on a silver platter, then no, they're
right.
not gonna get there.
So that's what the problem is.
That is the
Us
problem.
providing things on a silver platter. I mean, language is easier for them. Culture is easier for them. They were born in this country. They were brought up in this country. Kind of school is a little bit easier when like for us, we went from one type, one education system to another. We had to adjust and adapt. But the concept of the platter, I think the next generation, our kids' generation, is not gonna have the same hunger,
They don't. They
the
won't.
same
I
drive
agree. They won't.
for success. Does that mean they need to do so much better in school and academics because they're not as driven towards success? I mean, those are the things we could sit and ponder and talk about.
For hours.
But I think they gotta show us. I think we just gotta see what happens.
What do you mean?
And
We can. But you see, just like our parents did, they instilled certain values to us.
yeah,
But when we came to America, we had the drive to do what we have to do. It's either we do it, we want to make it. Why do we want to make it? We want to be comfortable. We want to be okay. We want to give to our kids what, let's say, our parents couldn't give us. See, that's the problem. We're giving our kids something that our parents didn't, right? Technically speaking.
absolutely.
But now, what does that become? That becomes that we are providing them things on a silver platter. So what I did with my daughter. Watch this. So my daughter, she she's like iffy about reading sometimes. She's not a fan. So I told her,
Second child,
second one, yeah.
second child syndrome. Yeah, my second daughter has
But
that
she
trend.
became phenomenal right now. So
Uh-huh.
so now she starts. I told her, listen, you read this whole book. You have a deadline. You have 1 week. All right. And she's been raving about sneakers. She wanted a Nike pair of sneakers. And she's like, okay, you read this whole book 1 week, I'll get you those sneakers. I don't care about the price. You want it? No problem. You got it. So she read the whole book. She finished the book. I went, I bought her sneakers. I did the same thing to my third son, to my other son. And they were so happy. Now my daughter, this conversation was like a year or two ago, I don't remember, but from that point on, she's been reading consistently without anything me giving them anything else.
That's
You know,
amazing. That was
so
that was
that was for me, that was amazing.
yeah.
So also, I follow Patrick Bet David. I don't know if you ever heard of him.
Yeah.
So he goes to Stories Kids and he buys everything they want. And and people are looking from the side. Why is he buying all these things for these kids? Spoiled brats. He's like, no, guys, you don't understand what I'm doing. I'm gonna buy this for $200. I'm gonna put it on the top of the shelf. He goes. So in order to get that toy, you're gonna have to read 3 books.
Positive reinforcement. It's a
Yes.
perfect example.
Yes.
Your daughter's story is a perfect example of positive reinforcement, and that is the way to go. We know that it's proven that it works, and
We
I
just
mean,
have to
we
constantly
have to
apply it.
do it. We
Yes.
have to constantly do it, and I do it, and I think that's the right thing to do. But the drive thing, I think, is still a factor.
Is without a doubt. But you see, the thing is, they have to find what they enjoy doing. Just like
Yeah.
you found
Yeah.
yourself, they have to have a they have to find a purpose. So for some people, it's easier than others.
Yeah.
Some people don't want to strive for that. Some people want to just lay back and do nothing. and these are the things that they have to. So if we can, let's say, build something where, like a questionnaire for a teenager to find themselves, that would be great. You think
Yeah.
that's doable?
Anything's doable. I don't know. Sometimes when I ask myself a question, if it's doable, the next my question in my head is, what would I have to do? What are the some components? So I don't have an answer. So is it doable? It's doable. I don't know how to do it. Some of these things are just so
Is
difficult.
it is it is it's very complicated to put together. It's a whole system.
Yeah.
But if we can definitely do our research and help our families and everybody else around, that would be phenomenal.
Yeah,
You
for
know,
sure.
what are some things that you wanna say to the younger generation who are going into college, or what would you recommend them? What is the one thing that you feel that you can tell them today and maybe change a part in their life?
I think things I'm gonna say are so cliche, but they couldn't be more true.
It is what it is. Listen,
I think set your goals, set your goals high. I mean, we live in a country where anything's possible,
agree.
anything's achievable. You can do anything you want. Look at Elon Musk. He wants to populate Mars, and he's gonna do it.
I honestly, I don't have a doubt. This
So
guy is
that's so
phenomenal.
that's my advice to a younger generation. I think set your goals high, and work for towards it. Work towards your goals. I mean, not having goals in life is like the worst thing an individual could do.
I agree.
Choose whatever it is you like doing, and go for it.
Have purpose.
Have purpose, have goals, and get up every morning and work towards it.
I love it.
There's no reason why you can't achieve it.
I agree. I agree 150%. Mr.
And
Yusupov, Mr. Steve, thank you very much. It was a great session with you. I enjoyed every single moment.
thank you.
Honestly,
I mean, we
the
could
vibe
continue
with
this
you.
for hours.
You know
I
what?
mean, if we had no time
We're
limit,
gonna
we would
do
sit.
we're gonna do an episode 2, and then maybe we can bring in an intern.
Yeah,
How
that'd
does
be
that sound?
fun.
We're gonna pick his brain.
Yeah, we could do that. I think what we could do is we could get some feedback
Absolutely.
from the younger generation, and I'm sure there are people who want to follow your footsteps. I mean, what you guys have done in the media world, in our community, I think is huge. I mean, I'm sure there are people who want to know more about this. I'm sure there are people who want to know more about healthcare. We could bring guests. We
Absolutely.
could bring guests from high school
I'm
generation, college, and have like a Q&A session.
absolutely
Yeah, I would love to participate in that.
great. Thank you very
Boris,
much.
thank you.
It was a
Always a pleasure.
pleasure. Absolutely.
All right,
Guys, stay tuned for more episodes.
looking forward.
Woo! I think that was great.
That was good, man. I was having fun with this.
Yes.